Hi everyone, Dr. Timothy Gallagher,
And Dr. Michael Marciello.
and we're from Maragal Medical. Well, we're at it again. We're adding new cutting edge services in our practice. You're definitely going to want to stay tuned to learn about new treatment options at Maragal Medical. Okay, as many of you know, we are a full-service physical medicine clinic where we've combined medical care, physical therapy, and chiropractic treatment all under one roof. And we have a special interest in the field of regenerative medicine. And Dr. Mike, over the years, regenerative medicine and cutting-edge technologies has really continued to show, in terms of the scientific data, outstanding improvement of patient outcomes. And we usually see regenerative medicine in our practice in the form of joint injections for arthritis, correct?
That's correct. And what we're trying to do is to really enhance the ability for the body to repair the damaged tissues of which they have. And that's chronic disease issues, arthritis and kind of inflammatory processes. So the regenerative injections help that person get to the point where they need to recover and reduce that inflammation and get them back in active mode.
Yeah, and this year we've launched our incredibly successful, all-natural, whole food-based medical weight loss program called NutriHealth, and we're seeing very positive results in treating patients with neuropathy. We had a patient a couple of months ago that came to us with diabetes, was looking for some extra help with neuropathy, also general wellness and medical weight loss, but he had a major problem. He had a wound on his foot that was not healing, and this has been going on for the last year. Maybe you could explain the typical medical management for these patients, because this really took me back. This poor guy was only in his mid-50s, and as the wound progresses, you may be looking at an amputation.
It's a big problem for sure, and there's a special interest of mine with family history of a lot of members of my family with diabetes and the complications of diabetes. And so we think about, we've been seeing more patients with the diabetic metabolic syndrome because they're coming in with back pain and overweight and looking to get into our weight loss program, the arthritic problem because they're overweight and not able to exercise. But when you think about the folks who have diabetic neuropathy, and they lose the feeling, their perception in their feet, or their perception of not knowing if they're walking on a wound or injury, they break down their tissue, particularly their skin, and they develop these terrible diabetic ulcers. And that could be a terrible problem because, one, they first don't feel it until it's too late, and then this infectious process or non-healing wound takes place. And so we started seeing a little bit more of these folks, and the concern is we needed to try to help figure out to get that person more active. And that's our goal here, right? We want to make sure people are functioning. Well, if they can't walk on their foot because they've got a wound, we needed to figure out ways in which we can try to help heal that wound when the standard practices of a wound care clinic aren't really working. So with us and our knowledge of regenerative medicine, we looked into the regenerative properties of ways we can treat these wounds, such as regenerative patches.
Yeah, these amniotic patches are well established in the literature. In fact, even more established than the regular joint injections. The first documented case goes back to actually World War I, where they were using birth tissue products to help to accelerate the healing in those cases. So we did our due diligence. We partnered with a group that has identified and can help us to get patients the care that they need. And we're really excited, once again, looking for cutting edge treatment options that certainly get to the root cause of the patient's problem. And boy, if you can help a patient to make sure that they're not facing amputation, that's very powerful.
Well, without question. So, that's an extreme case, but we know that the diabetic numbers across the country are increasing. Nearly 1 in 4 patients have some either pre-diabetes or diabetes kind of tendencies. So we're going to see more and more of this potential problem as people get older.
Right.
And we recognize that our patients are getting older and we need to make sure they remain healthy. So looking into the regenerative properties for more of the standard wound that might be a little smaller, maybe not quite getting better in the standard practice, we have another avenue to help them get through it so we can keep them on track, keep them moving, and then bring them back to a better health.
Yeah, and of course, the main goal is to make sure it never gets to that point.
Absolutely.
So really emphasizing, the whole approach and the wellness approach that we have here at Maragal Medical to offer you, including medical weight loss. If you want more information about our practice, just look us up on the web at maragalmedical.com, and then consider subscribing to our YouTube channel. We've got a wealth of information there. That's it for today. If you know of a patient that's struggling with diabetes, and if you know of somebody that has a wound that is just not healing to traditional medical care, have them give us a call. I know we'll be able to help them.